Good day, everyone. Thank you for joining us with the Association of Black Social Workers Dealing with Racism, Lessons Learned from Because We Matter, which is an Afrocentric healing program that we have launched in Nova Scotia, Canada. My name is Veronica. I am a social worker. I've been a social worker for the past 40-some years. I worked in frontline child welfare for a number of years, then went to management, supervising and managing a number of offices in our region, and also did some post-adoption, retired from government and went to the private sector, running a children's residential facility. Now I am semi-retired as a property manager at the same institution and working on the side with the Association of Black Social Workers. I'm also a mother and a grandmother. My colleague.
Thank you. It's really nice to be doing this presentation with you, Veronica. I'm Wanda Thomas Bernard. I currently sit as a senator in the Canadian Senate. I was appointed in 2016. I often say I'm a social worker who's moonlighting as a senator. I've been a social worker for about 45 years. I've worked in mental health, I've worked in community practice, and I taught social work at Dalhousie University for about 27 years and was director of the school for 10 years. I'm also a founding member of the Association of Black Social Workers. And we're presenting this presentation on some of our work. We'll transition. So the Association of Black Social Workers was established in 1979. There were 4 founding members. I was one. We were 4 women. We formed an association largely because we were very concerned about the needs of African people in Nova Scotia that were really not being met by the social work community. I was the only member of the group who had a degree in social work. The other 3 were social service workers working in different fields of practice, in prison reform, and in family life studies. About 6 years ago, we started with an outreach social worker that's funded by our local Department of Community Services. And it's the first time that we actually had a funded position with the organization. So for most of the life of this organization, we've operated from the sides of our desk. Okay. So the objectives of this program, Because We Matter. The objectives of the organization, sorry. The objectives of the association, we do a number of interrelated things. So we provide education by providing courses and seminars and a number of different programs. We also assist with financial assistance with students of African descent who are in social work programs at Dalhousie University. And we do a lot of work with community-based organizations, largely to ensure that all of the organizations in Nova Scotia are providing services that truly meet the needs of people of African descent. Ultimately, that's our primary focus as an organization. So today, we want to start with a discussion of anti-Black racism, what that is and why this work, we've undertaken this work. And then we'll do a review of the program, the Because We Matter program that we've launched. And we'll wrap up with a discussion of some of the lessons we've learned through our work. So understanding racism. One of the things we want to make sure we are all on the same page. So when we think about racism, we like to think about racism as being prejudice plus power. but it's also a belief in superiority. It's a belief that human races have distinctive characteristics that determine their respective cultures. But it's also, one of the most significant parts of understanding racism is that belief that one's own race is superior and has the right to rule others. And in addition to that, it's a policy of enforcing those rights. Racism on its own doesn't have a lot of power. But when you add the prejudice plus the power and an enforcement of rights, you have racism. Anti-Black racism is racism directed specifically against Black people or people of African descent around the world. So when we're talking about anti-Black racism era, we're seeing a worldwide pandemic of anti-Black racism and the protests around Black Lives Matter, and it's speaking specifically to anti-Black racism. So in this program, Because We Matter, we grounded in Afrocentric theory. Afrocentric theory is a theoretical base that we use to address anti-Black racism. And primarily what we're trying to do is to provide better supports for staff, but ultimately better supports and services to our clients, the people we work with, the underserved. There's also the approach to addressing anti-Black racism and other forms of oppression in the workplace. So we're addressing anti-Black racism to provide better supports, addressing it in the workplace. And third, it's to build bridges across cultures. It's also to break barriers. What are the barriers that prevent us from fulfilling all of our goals and objectives? It's creating awareness. How do we create awareness in larger society? And it's also about leading change. So how do we lead the change that we want to see? So we use the Afrocentric theory in the Because We Matter program to really cement the work that we're doing.
So now what we're going to do is just give you a little bit of information on the actual program, Because We Matter. So this program is just one of the various sessions, training opportunities that we offer through the Association of Black Social Workers. So Senator Bernard has already told you about ABSW and the uniqueness of that organization. Like, we're the only ABSW in Canada. We're the only organization that, and we've been existing for the past 40 years. So this program, Because We Matter, came to be back in 2017, and actually it started earlier in 2017, because there were a number of concerns that came from the Black staff. When I say Black, I'm talking about people of African descent. In our province, we refer to them as African Nova Scotians or African Canadians. So Black people in our province. So a number of the staff came together. They were concerned based on the racism that they were encountering in their workplace. And then also they were concerned about the poor climate people of African descent were encountering from their various programs. So they presented these concerns to senior management in their organization in December of 2017. And that launched a whole new program for us in ABSW. So at that time, contact was made, actually it was with Senator Bernard, saying, how can ABSW assist us? We've been doing Afrocentric training for a number of years, so how can we assist that organization? So, and what was clear to us is that the Black staff needed healing. They were all encountering so many racist attacks that they needed to heal before we could move on and train others. So that's how we end up calling it Because You Matter, because we matter as a people. So we chose facilitators, we developed the program, and then we launched the first session of the program in May of 2018. And the program ran for almost 2 years, a year and a half, and then also was launched in other departments and organizations. Now, with the Because We Matter, it's not just the child welfare, it's not just the social workers in the organization, it's all program divisions, all programs in an organization. So if it's in a nursing facility, it would be the dietitians, it would be the nursing staff, the health services, anyone within the organization. So the objectives for the program is that we really wanted African Canadian folks who are working in the organization to understand the systemic oppression and the impact that the trauma that they were encountering in their workplaces, in their lives. And so we took them through that exercise. We wanted to not only just understand the systemic oppression that they were encountering, but also to identify strategies to address it. And then, of course, in any training session, you want to look at individual and collective action plans that result out of that. So the program itself, the overview of it, it was a total of 4 days for the program. So there's a large commitment by the organization. So they would remove the staff from the floor from whatever their duty was for a total of 4 days. But we recognized that 4 days to get somebody out of their job, as much as the managements to have this done, was no small feat. So we constructed the training so that it would be delivered in 2 days at a time. So there would be 2 days of the training. They'd have a month break to reflect, to do some necessary work, and then come back in a month's time with the other 2 days. Every one of the sessions started with music that was strategically chosen. So when the participants entered the room, there would be music in the background. And some of the songs that we played were the Williams Brothers, Still Here. Because as a Black people, no matter what we've been through, we're still here. And so every song, so 4 different songs every day. Videos that we selected, they were all geared towards the learning and the healing that we wanted the participants to participate in. It would not be a social work initiative if there wasn't a small group or individual work. And so they had to reflect, they had to go back. There were exercises that they had to do either individually or as a team. Then there was the lectures to help them understand the various topics that we had selected for them. And then also there was a talking circle. That was the opportunity where they came together in a circle with a talking stick and really shared their experiences, how their trauma, their hurt, talked about some of the statements that were made to them. For example, one staff person cited an incident where another staff person asked them if they wished to have their plant. The white person said to them, to the Black staff, you know, it looks like marijuana and you're Black, so you must want this. So that person held on to that. That had occurred to them a number of years back, but they still remember. It still was trauma for them. Like, why would this, my colleague, my staff person, why would they say this to me? This is just giving you a sense of some of the hurt and the trauma that the participants were encountering. One person that's from the park, which is an area for us in our province, in our community, where a number of minority folks live. And so they basically said to another worker in that field, you don't need to deal with them. You don't need to deal with them, with those people from that area. And so the stigma that that worker carried, who was also Black and happened to be from that area. So it was some of those examples that they were able to share and the talking circle. And it was really quite enlightening to them as participants, because they were talking only to hear of all of the other situations that their colleagues had encountered as well. And then what happened from that is that we also had a graphic designer come in and record those statements. And Senator Bernard will show you one of the samples of the graphic recording later. So a standard program, what happened, we had the welcome music that I already spoke about. Everybody had to do a check, and even though we were from the same organization, they may not have known it. You know, one of the organizations had over 1,500 staff. So, and if they were the admin, they may not have known who they were in another program sector. So we had our check-ins. How long were you with that organization? You know, some, they ranged from newbies, a couple of months, to 40 some years. And we asked, well, why are you still there? If you're going through that much trauma, why are you still there? But they stated things because the clients, they were there for the clients. If we weren't there to work with people who look like us, who's going to do it? It was also interesting to note of the number of training sessions that we did. And it was vast years of experience that these workers had. In one of the sessions, it was over, oh gosh, 251 years of experience these 15 people had, but none of them were in management. But yet they've been there for, you know, 20 years, 15 years. But yet no one had been in the management sector. So we did a review of the agenda, took them through what they were going to be learning in the next day, the next 2 days, and over the course of the whole session, the 4 days. We did a review of the group standards, which meant that they had to develop group standards, group rules, different terminology for them, but they had to develop them at the onset. And then every session we go in, just remembering these are the rules that you established. Turn your cell phone off, you know, whatever it happened to be, they agreed on it. And then we ended every session with a meditation. We knew how challenging some of the discussions were at the table. We didn't want to send them home with that. And so we allowed everybody to calm down, bring their spirits back, and then before they were able to depart from us, and then we wrapped up the sessions. So some of the topics that we discussed, you know, the history of African Canadians in this country, let alone our province, Nova Scotia. It's the same history that non-Blacks would have received. So we asked them, what did you learn? And most of the history that they would have learned, it was not anything about the valuable contributions of Blacks in our country, in our province. And so we gave them some of the history. And then we talked about the anti-Black racism, what they were encountering, what we're seeing every day in the media, the situations that are happening. We talk about why we matter and the impact that those anti-Black racist events were having on them. We did a session on the masks that we wear. And it was really quite interesting because people talked about the minute they stepped outside of their house, it was like they put on a different mask, because they knew that, and especially in our province, when you go to an event, chances are you might see 1 or 2 people who look like you, but we're not the majority. So they know that they had to, their demeanor was always in a different way. So it was always a mask that they were wearing. We did definitions. We had people break up into groups, and everybody hears about Afrocentric. Well, what does it really mean? Racism, what is it? And we had them define it, and then we would give them some definitions. Most of the folks were right on target with them. We talked about the talking circle already and the graphic recording that resulted. And then, of course, the psychological effects of the trauma and racism that they were encountering and what they were healing from. Other topics that we covered in the training is best practices for dealing with racism. You know, we all know that, you know, how it makes us feel. You know, you could get angry, you want to scream out. Well, what's the best practice for dealing with it? Because you need to survive. We talked about reparations. That's a new term, or it's not really a new term, but it's picking up momentum. What does it really mean? What is it that people are looking for? And emancipation. What are we talking about? So we needed to be able to educate our people so that they could be informed about these terms as well. We did a whole section on the Afrocentric theory, an introduction of it, what Afrocentric trauma-informed practice means. We talked about the healing and the self-care, because we know that in order for us to continue on day by day, we need to have self-care. And there were samples of that. We asked them, what do you do? And a lot of times they didn't even recognize what it was that they were doing. And of course, the impact of racism, and also, where do we go from here? Action planning.
So as you can see, the 4 days that we had with participants was really quite intense. And we did these in small groups of about 30, 35 max. And each of those groups had a talking circle where participants could freely talk about their experiences of racism. And we had an artist come in and do a graphic recording. And so this is an example of graphic recording from one of those sessions. And then from that, we identified a number of different themes that we were able to use to capture, we'll go on, to capture the experiences of anti-Black racism. Now we're talking to a group of social workers, international social workers. Some of these experiences happened in social work, but they were happening in other workplaces as well. But for the purposes of our discussion, you need to keep in mind that these were experiences that people were having in social work. So individual acts of racism, Veronica already gave you a couple of examples of those. Systemic racism. Veronica also alluded to systemic racism, the fact that many of these workers had so many years of experience, but none of them were working in leadership positions. And none of them had been mentored to go into leadership positions. None of them had been encouraged to even apply for leadership positions. Yet some of them actually trained the people who'd come into the agency as newbies and were then working as supervisors or managers. So they ended up training the people who ended up supervising them. So the examples of systemic racism were, quite profound. Microaggressions, daily microaggressions. And sometimes it's hard to determine, what's an individual act of racism, what's a microaggression. Microaggressions are more invisible, they're more insidious. It's the kind of thing when someone says, one of the things that happens a lot, and especially with women of African descent, is about our hair. Can I touch your hair? Or not even asking, but just coming up to a woman and touching her hair and making comments about one's hair. Those are such negative, racist microaggressions and they happen so frequently. And if you dare talk about them, then you become labeled as the person who has a problem. Racist stereotyping. One of the examples is a Black male social worker. Most of you who are watching this presentation, you will likely agree that we don't have a lot of men in social work, and we certainly don't have a lot of Black men working in social work, certainly not in Canada. In this one example, this Black male entered the secure parking lot of the social worker. One of his white female co-workers witnessed him entering the building and sent an alert to the office saying there was a Black male intruder in the building. This Black male social worker had no idea that he was being labeled the intruder. He's in his workplace. He had every right to be there. He starts looking for the intruder because he had no idea that the intruder was him. So that kind of racist stereotyping was so prevalent. And then we certainly heard from all of our participants, as they shared in the circle, you could see the pain, you could see the trauma, you could see the impact that the years of racism, these weren't one or two incidents, but it was the cumulative effect of racism. And they also talked about racism as being a form of violence, and the comparing when someone has an experience of violence and then that they have to retell that story, they're reliving that violence. It's the same thing with the racism. When you have an experience of racism or you witness experience of racism, it's violent and it's traumatic. And when you retell it, you relive it. And that's why the self-care piece is so important. And so we try to really help people unpack that and understand it. But one of the most profound things I think that ABSW realized through this work was that through all of that, through all of those experiences, these people still got up and went to work every single day. These people still got up and went to work and did their very best every single day. And so the theme we used for that is Still We Rise. And as Veronica was saying earlier, it was largely because they knew that if they were having these kinds of horrific experiences, then the clients that were being served were likely experiencing racism as well. And so they stayed to ensure, to the best of their ability, that the clients had the best possible services. So recommendations. So through that, through creating action plans, individual but also institutional action plans, recommendations came from participants. So one recommendation was that a presentation should be made to senior management, and they did that. Some of those participants actually came and did the presentation in real time because they really wanted, by that time they had found their voice and they really wanted to present to senior management themselves. So they worked with ABSW to draft a report, and then the organizations responded to the report, and accountability measures were built in. So it was made very clear at the outset, yes, ABSW will do this work. Yes, we will do this healing work. Yes, we will engage in this work with you. However, one of the things that's really, really important is that some actions must come from this work. And the actions need to flow from the healing work to institutional change. And people were really, really strong on the institutional change. And that's why very solid accountability measures were built in. Okay. So what did we learn from doing this work? What did we learn from the participants? What did we learn from the organizations? Because after all, the focus for change really was around institutional policies and practices. So first of all, left unchecked, racism definitely has an impact on health and well-being of individuals, but also on the workplace. You know, we often talk about toxic workplaces, and we certainly saw that. And ultimately on the clients being served. So if we want better outcomes for clients, we need to address these issues upstream. Staff empowerment. As I said a minute ago, staff found their voices. And we talked earlier about the systemic racism that had kept many of these long service employees from even considering leadership positions. And since then, several of them have applied for and are now working in senior leadership roles. They would not have done that before this initiative. We've seen some significant management actions. We've seen significant change leadership happening with management in these agencies. We've seen changes with policies and with practices. We've seen changes with expectations of what would happen in agencies. And even though we're in the midst of a global pandemic of COVID, we're noticing that these agencies are still very committed to the actions that they committed to do. They continue with those commitments. And because of that, we're seeing better service outcomes for clients, better service outcomes for communities. We saw that during COVID, really significant input from these agencies in terms of how do we best meet the needs of our Black clients. We also recognize that there's a significant need for Afrocentric training in various sectors. As Veronica said, this work started with one agency, but then once the ABSW started hearing from many other agencies as well, that they needed this level of intervention. And so ABSW has tailored the work to be able to provide for different levels of need in different agencies. But we also recognize the need for Afrocentric theory to be taught in social work programs, in mainstream social work programs. That's not happening nearly enough. The Dalhousie School of Social Work was the only school in Canada up until this year, the only school in Canada that actually offered an Afrocentric social work course. Now there are 2. But there are 34 schools in this country, so we need to do more. So in a nutshell, that's the work that we've done with this particular program. We always end each day with a meditation, and this meditation is about Black Lives Matter. Given the global pandemic and the pandemic of anti-Black racism that's more globally recognized now because of the killing of George Floyd, and there have been protests around the world about Black Lives Matter. We have the link here to this meditation, and we invite you to engage in that meditation at your leisure. We really invite you to do that. We also want to let you know how you can contact us. So we have the email address for the Association of Black Social Workers. We have the website address, and we have the Facebook address. And we're just in the process of setting up other social media. So we encourage you to follow us, check, come back, check, see what other things we're doing. And if you want to learn more about some of the initiatives that ABSW is involved with, you can check us out on our website. Thank you very much for watching our presentation.